Temporary increase to the Supplemental Nutrition Assistance Program, or SNAP, is set to expire this week. The end of the pandemic-era policy is expected to impact more than 41 million Americans. The average SNAP recipient household will see their benefits drop by at least $95 a month. Food banks around the country are bracing for increased demand as food prices continue to soar. Let's bring in Kyle Waide to talk more about this. He's the president and the CEO of the Atlanta Community Food Bank. Thanks so much for joining us, Kyle.
Well, thanks so much for having me.
So, as you are aware, economists have drawn parallels between this policy and reductions in poverty, real reductions. So explain to our audience why the government is allowing it to expire.
Well, what's basically happening is, as we all know, we're trying to get the economy out of an inflationary condition and back to sort of normal operations after the pandemic. And so they are just pulling the program back to where it was pre-pandemic. What we know is that because in Georgia, this got discontinued back in last spring, that we've seen a really significant increase in visits to food pantries across our network since those emergency SNAP allotments were discontinued. And we know that this is going to increase demand at food pantries all across the country.
So, people should sort of understand that the SNAP benefits were sort of in place to help during the pandemic. But here's what happened since then. The price of food has gone through the roof. Even when, other prices have sort of stabilized or gone down, it's still super expensive to buy food, particularly healthy food. How have you seen this temporary boost to SNAP benefits help people in your community?
Well, what we know is, as you just described, the pandemic really exposed all sorts of vulnerability across our communities, across the country. There are a lot of people who are really living paycheck to paycheck. The inflationary environment coming out of the pandemic has put extraordinary pressure on those families. And alongside that, there are other federal programs that were enhanced during the pandemic that have also been discontinued. Things like the child tax credit that went away in January of last year. We had the discontinuation of universal free school meals, which also had a big impact on reducing need. And so that combination of increased costs and reduced resources is really putting a lot of families in harm's way economically. We know that when people have access to healthy, nutritious food, they have more stable lives, they have better health outcomes, and they are able to solve other challenges that they're trying to face and really invest in their future. And so we are urging our lawmakers to find ways to continue to invest in these families and would argue that continuing these SNAP enhancements would be very helpful.
All right, so now that this policy is ending, how are you preparing for it?
Well, like many food banks across the country, what we're experiencing is that lines are just getting longer. We've seen about a 40% increase in visits to our network over the past 15 months. And at the same time, we're trying to meet that demand with fewer federal resources in terms of the amount of food that's available. So we are buying food in ways that we never have before historically. My food bank is spending more than $2 million a month right now to purchase food to help meet the demand. We're able to do that right now, but long-term, that's probably not a sustainable pattern. And so what we're also working hard to do is just to make sure our lawmakers are aware of the demands that we're seeing and that the real opportunities for us to find ways to invest in families.
I think that people need to understand, too, that there's sort of like a trickle-down impact, right? If people can't afford healthy food, then they buy alternatives, right? And those alternatives may not be the best for them. So eventually, if you don't pay up front with healthy food, you might pay on the back end with these people who are in need of healthcare services.
Or if you extend that even further, you are eating unhealthier foods, which lead to medical conditions.
That's what I'm saying. That's exactly what I'm saying.
The system,
right?
Which we don't have really.
You'll pay for the healthcare services if you don't pay for the healthy food. And so I want to ask you, what are some of the choices that you see people make when they don't have this sort of assistance?
Well, you all just described kind of the crisis of food insecurity, the cycle that people get into of having to choose to eat less nutritious, less expensive food, or to skip meals or to engage in other kinds of coping mechanisms to deal with their food shortage. That leads to negative health outcomes. It leads to higher expenses, lost incomes, and then people are being forced to choose between paying for food or paying for my medication, paying for food or paying for my light bill or my rent or mortgage. And so when we can help people have access, consistent, reliable, frequent access to food that they need, it means not only are they getting that food, but they're also avoiding some of those bigger challenges. More importantly, it also helps them begin to think about investing in a different kind of future, to really begin investing in discretionary needs around upskilling or moving to a better place to live in a better school district. So when we can get people access to food, it stabilizes them and also helps them think differently about their future, gives them more bandwidth to really plan for that future.
Kyle Waide, thank you so much.
Thank you for having me.